Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
And we're going to talk about the ducts that carry the bile inside the liver and what can happen to them as part of what we're going to be talking about in the next few minutes. If we can play, please, that image that had that green gallbladder with the stones inside, so we can have it for, and also the next image with the stones will be great, so we can explain what is going on there. Yeah, so in this image here, we can see that green sac that represents the gallbladder, which is basically a sac, that is lying, underneath the liver. Okay, so now, as you can see, you see this green duct connecting that sac to the duodenum. Duodenum is part of the intestine. And then we see also is connecting other pipes or other ducts, and all joining into one duct that goes into the second part of the duodenum. This is what we call the common bile duct. The stones that are inside the gallbladder, as long as they stay inside the gallbladder and do not travel to the duct, we have no problem. The patient is asymptomatic. He has the gallstones, but he will not feel any symptoms. Now, if the stones become too much and you push under the liver is on the right side, you push under the liver and you feel pain, this is a problem, now becoming symptomatic. So how does it present? With the right upper quadrant, right upper abdomen pain. Okay, where the stone is, how was it made? Is made from cholesterol. It could also be made from pigments. So if we measure the cholesterol and is high, most likely the stone came from that high cholesterol. But if we measure the cholesterol and is normal, then most likely the stone came from other pigments. The trouble is when one of those stones move, like you see in this image here, and they can block the duct, especially the common bile duct. How can we know the duct is blocked? It's very easy. We look at the ultrasound. The patient will do an ultrasound. Ultrasound is very easy. Every office has it. And we can easily see signs that will tell us the common bile duct is blocked. And when the common bile duct is blocked, the sac will be dilated. And above the stone will also be dilated, especially if it's complete block. So what are the consequences when the duct is blocked? This is bile acid. Bile acid is, as you hear, acid. So it digests fat. So the patient, if the duct is blocked, he may have steatorrhea, which is floating stools, because we're not digesting the fat like we're supposed to. So now, what else can we have? We can have signs on the ultrasound that will tell us this patient definitely have a common bile duct stone. So we do not have to go to invasive procedures to tell that this patient has a common bile duct stone. Simple ultrasound and the clinical presentation will definitely tell us that this patient has a common bile duct stone. So what can this patient present with? Well, we can present with cholangitis, which means inflammation of this duct, because we said this is an acid after all. So when it stays too long in that duct, it causes inflammation. It irritates the walls of the duct from inside, and that can cause inflammation. And now when we have such a thing, the patient will have a little bit of fever. Not only that, the patient can also be a little bit yellowish. The skin will be yellow, the eye white will become yellow. So that's a condition we call cholangitis that has to be taken care of with antibiotics and also with other medication. Now, this is not so bad, but there is much serious complication when one of those stones get stuck in this duct. As you seen in that image before, this duct is also connected to the pancreas, meaning the pancreas joined this duct at some point before entering to the duodenum. When we have too much bile acid inside that duct and inside that sac that we call gallbladder, the chances are this bile will spill over. It's too much now, it's too full, will spill over and go to the pancreas because the pancreas is very close by. So we have now a condition called acute pancreatitis, inflammation of the pancreas, and that is very bad. The pain is so severe, epigastric pain, right here in the middle. So bad. The patient is nauseated. The patient feels like want to vomit or actually vomiting. There is a little bit of fever. So this is a condition that is acute pancreatitis. And I remember we have mentioned last session that acute pancreatitis, one of them the patient will survive and one of them the patient will not survive. Which one the patient will survive? If it's interstitial pancreatitis, meaning it's just inflammation of the tissue of the pancreas, but I don't see black necrosis. I don't see dead, rotten cells of the pancreas. How can we find out which category it is, which pancreatitis we have? Simple CT scan will do it. A CT scan will tell me this is necrotizing pancreatitis or just interstitial pancreatitis. The chances that you make it if you have necrotizing pancreatitis is very limited. The pancreas is gone. So when we have acute pancreatitis, we have to think now, what is the function of the pancreas? Well, the most important thing, or one of the most important things of the pancreas, it secretes insulin for you. Insulin is the thing that adjusts your blood glucose. So if you lose the pancreas, you have lost insulin. And if you lose insulin, you have diabetes. You have diabetes. Beside that, the pancreas also secretes some enzymes that are necessary for digestion. So you will have malabsorption, you'll have maldigestion, you will have a lot of other problems as well. You will have hypocalcemia because the absorption of the calcium is not there. So you will have muscle cramps. So that is acute pancreatitis. That is the things that you need to know. So how did acute pancreatitis started? One of the reasons, not all, there is other causes for acute pancreatitis, is simple gallstone. And how can I see a gallstone? Simple ultrasound. And how can I do an ultrasound? Simple checkup. Checkup, you do an ultrasound. So if you see stones in the gallbladder, that is a warning sign. If you see stones in the gallbladder, in the common bile ducts, so one of the stones has traveled from the gallbladder into the common bile duct, that's a danger sign. So I'm sure it's done here also. There is something called ERCB, okay? We have a video. I don't know if it's ready or not. If it's not ready, it's okay. If it's ready, we can play it, called ERCB. ERCP video to see how we can go inside, take the stone out in a very easy way. It looks easy, but of course it requires a specialist to do it. It requires somebody who knows how to do the ERCP. Yeah, see this image here, it shows you the pancreas. It shows you the pancreas. You see how close is the pancreas, and you know how close the pancreas to the duct. You can see that very clear. It's very close approximation of the pancreas. Okay, the pancreas is very close to the common bile duct. You see the common bile duct there, the green one, going through that looks like a corn. So this is what we call the pancreas. If we have a stone lodged there, then we have a spillover of the bile acid into the pancreas, and the pancreas is injured. And that's what we call acute pancreatitis. Now, there is the the ERCP video. If we can play it, it's taken from Cincinnati. I think maybe the video is not ready. Cincinnati children. This video is not ready. All right, so it is okay. It is okay. If the video is not ready, we can play it another time. There's no problem. I think it's my fault because I didn't download it here. So okay, so now we understand what is going on with how acute pancreatitis can happen. But there is also other causes for acute pancreatitis. But the one that the target of our talk today is that gallstones. Gallstones. Now, let me describe to you the ERCP. We will go inside from the mouth with a flexible tube that carries devices and wires inside, all the way to that part of the intestine where the duct is emptying, and then a wire will go inside the common bile duct, past the stone. Then this device, this wire here, has a balloon that will inflate small, and then would drag it out and would drop the stone. You know, as I prescribe, it is very, very easy, and then problems are solved. This is what we call a procedure called ERCP, which we put that device in the mouth, get to the second part of the duodenum, and send the wire, you know, past the stone, inflate the balloon, and then drop the wire into the second part of the duodenum, and the story is finished. There's no complication. Done. But it has to be done by somebody who is who does this procedure all the times. Now, if we see the stones and they are many or thick, we have to dissolve them with a drug. After we do the cholesterol level, we have to dissolve them with a drug called orso. This drug, if you want to know, has a history. The Chinese made this drug. They take those Chinese black bears, those big animals, and they insert a tube that reach to the gallbladder of that animal and take that bile salt and bile acid from the gallbladder, and from that material they make the orso. It's a very good drug, and it has the capacity to dissolve the stones. So this is gallbladder stones. We call it cholelithiasis. What if the gallbladder wall now becomes infected and inflamed? The patient will have terrible pain, will have fever, will have increased white blood cells. We have an image also for this ultrasound image, and this is also can be easily diagnosed with the ultrasound. That image that's black and white that says thick wall. If we can play that image, will be great. So you can also see that the wall in this gallbladder is very thick, and it can be easily identified doing an ultrasound. Of course, the patient will tell you, I have pain here, And especially, I get pain when I eat something that is fatty. When I eat something that has oil or fat, I get a lot of pain. So you already know. So you're already suspecting that this patient may have a condition called cholecystitis. Forget about the medical name. It's just inflammation of the wall of the gallbladder. This patient has to go on specific antibiotics for a certain amount of time. Most likely it's going to be drips, not tablets, because the patient tend to vomit. And we have nausea, so you cannot give anything by mouth. And this patient easily recovered and is no problem. Life goes back to normal. So this is a condition that is called cholecystitis. Okay, so can cholecystitis happen only with a stone? No, it can happen also without a stone. But to have thick gallbladder wall without a stone, you must be admitted in a hospital for for like, let's say, some surgery. You intubated. You must be in the ICU for some times. And those patients, we call it hospital acquired disease. Those are the patients that we have no stones, acalculous, meaning no stones, yet the gallbladder wall is thick and they have the cholecystitis. So, but this is a condition for a patient. Thus, we call it doctor-induced or hospital-induced disease. When you're in the ICU for too long, we find out that you have this acalculous, no stones, cholecystitis.